On Tuesday, state health officials reported 1,575 new COVID-19 cases in Oregon. That's one of the highest daily case counts since the pandemic began.
It seems to me that this is the fastest rate of rise of cases that we've seen.
Dr. Ann Loeffler is Deputy Health Officer for Multnomah County. She attributes part of the steep rise to the Delta variant. She says it's 2 to 3 times more contagious than the original viral strain and more likely to cause breakthrough cases. That's when vaccinated people get COVID.
Now, there's some data that at least some people who have breakthrough cases have high amounts of virus in their nose. But guess what? If they keep their mask on and they keep their distance, they will not spread it, even if they don't have symptoms, even if they don't know it's COVID.
It's why state and local health officials stand by their recent recommendation that everyone, vaccinated or not, go back to wearing masks in indoor public spaces. Health officials are most concerned over the increase in COVID-related hospitalizations, the most they've seen in Oregon since last winter. As of Tuesday, the count stood at 379. That includes 119 patients in the ICU.
The problem is that the hospitals are very full. And even if you don't get COVID, you want the hospitals to have space for you if you're in a car accident.
The state is not seeing the same kind of rise in COVID-related deaths. They reported 9 on Tuesday. That's in line with the death rate we've seen since March. However, Dr. Loeffler says people rarely die within the first couple weeks of getting COVID. That means we may not see deaths related to this surge until next month. Bottom line, doctors tell us most COVID patients who end up in the hospital are unvaccinated.
The vaccines are still great.
For that reason, Loeffler hopes holdouts will get the information they need to finally feel comfortable getting the shot.
The good news is the vaccines are still preventing the most severe disease. They're preventing hospitalizations. And that's what we were hoping for.
Catherine Cook, KGW News.